Hi, I'm Kenny from PhysioK, and in this video I'm going to show you a few exercises which are very good for your low back, tailored for people who have disc issues or sciatic nerve problems. The first one is called the cat-cow exercise. So we can do this one on the floor, on a mat, or we can be on a table like here. Make sure you're on all fours position, your hands are underneath your shoulders, your knees are underneath your hips. From here, we're going to take the pelvis, which is located just underneath your low back, and you're going to rotate or tilt your pelvis forwards and backwards. Make sure you don't go too far. The difference with a normal cat-cow is, for a normal one, you would go all the way forwards and all the way backwards, and you'll push a bit. With this one, if you have any disc or sciatic nerve issues, you make sure that you stay mid-range. So here is far enough and there is far enough. So we focus on mid-range movements and do this for about 1 minute, if you can, multiple times a day. The second exercise in this bracket for your low back, tailored for people who have disc issues or nerve or sciatic nerve issues, is called a Mackenzie extension exercise. So for this one, you can lay on, again, on the floor, on a mat, or you can lay on a table like here. You lay on your tummy, and from here on we'll come up. So try and lean on your forearms. Yeah, put your elbows underneath your shoulders and then try and extend in your low back and look up with the head here. You'll have a little bit of compression in the low back, which is great for your disc. And you can also feel a little bit of stretch in the front. So that's why you have to look up to have the maximum amount of stretch in the front. Stay there for 20-25 seconds and go down and do that 4 to 5 times in a row. If this is too easy for you, then we can go to the next step, which is trying to extend our elbows. So put your hands underneath your shoulders, that's it. Extend your elbows totally. Try and relax in your back all the way up till here. Let it lean on the table, and also try and look up. Again, this will create a good compression in the low back, and have a bit of stretch in the front there. That is a very good one for people who have disc issues. So stay in a position, okay, you can down now. Stay in this position for 20 seconds and do that 4 or 5 times in a row. The third exercise in this bracket for low back, tailored for people who have disc issues or sciatic nerve issues, is called the stretch of the piriformis. So for this one, you lay on the floor, on a mat, or on a table like here. You'll lay on your back and we'll try and pull our knee up. So you'll grab your knee with one hand and you'll grab your heel with the other hand. And the purpose is that you'll try and pull your knee towards your opposite shoulder. So pull your leg across, that's it. Make sure you leave your head on the table, relax there. You should feel a deep stretch in there. The piriformis is a muscle that's laying in the pelvis underneath your glutes, and that's a very important one for your nerve. So if you have any kind of nerve issues, make sure you do that stretch. Hold this position for 20 to 25 seconds, relax. Do that 4 or 5 times in a row. Make sure you have a straight angle in your knee, which is 90 degrees like this, and pull across, so that's perfect. And hold this for 20 to 25 seconds. The last exercise in this bracket for your low back is called, is actually a nerve slider. So we'll lay on your back, on a table, on a mat, doesn't really matter, and we'll start with bending our knees like this. Good. If the problem is on the right side, then you'll do the exercise with your right leg. So you'll put your knee on top of your other knee, that's it. And then in this position, relax your foot and try and extend your knee up and down. So don't hold, don't try to stretch. We're trying to glide here. So we'll go up and down like this. That's a good warm-up, or it could also be enough for you. If you start feeling any numbness or pins and needles, you can feel a little bit, but it shouldn't be too much. We'll try not to push here. If you don't feel it too much, we can go to the next step, which is the same thing, but at the same time, you'll pull your toes towards your nose like this, and you go down, yeah, leave your knee on top of the other one, yeah, and you put your foot down. That's it. So up and down. Good. Do this for about a minute, doesn't really matter, 20, 25, 30 times, all the way up. Good. And down. Good. We're trying not to push here, we're trying not to stretch too much. It's a nerve glider, so it's trying to let the nerve move a bit in its components in the body. So that's a very good one to get a bit of gliding your nerve. So these 4 are the best ones to do if you have any low back pain, definitely if it's compared with some disc issues or also with nerve issues. Try not to push too much with these ones. We'll try not to stretch too far. We'll try not to compress too much. So make sure that you do them a bit more often, a bit more frequent, but don't push too much. And if there's anything, just give me a shout or contact me on the website.